I can't hear you.
All right. I was getting a little nervous there that Instagram wasn't going to let us go live. Super special guest today. August is joining from Microgenesis Fertility, one of the co-founders. And we have updates for you on my frozen embryo transfer. We have really incredible conversation to have around microgenesis, your microbiome, what the fertile biome is, how I prepared for my embryo transfer, how you want to prepare for getting pregnant or going through IUI or IVF or ART. So give August just a second. She's going to be joining us. Hello. Hi, August.
Hi, Alice. How are you? Nice
August
to see you.
Asperos. It's so good to see you. You look beautiful.
Thank you. So do
I feel
you?
like you're very well, do I have the pregnancy glow yet? I mean,
Yeah,
fingers
you are.
crossed.
Yes, I have my fingers crossed.
I still think it's the microgenesis glow. I think like at this stage of after my embryo transfer with Dante, I already was breaking out so much. And that didn't happen this time. And I think it just goes back to the microgenesis success of like
Yes.
everything I did to prepare for this transfer.
Okay, this is probably, I hope so. Yes, we are very happy to do this with you. So probably you will be pregnant and we will be all very happy.
Yep, let's hope, let's hope. So I want to give everybody some background. So this is a company that we've been working with for months now. And it's
Yeah.
one that you've all maybe have heard of because you've seen us do these lives. August is one of the co-founders. And the program is really incredible because it's the first time we've been able to bring to market something that looks at functional microbiome. And so the research that these women did, and Gabby Gutierrez is the other co-founder. The research they did is amazing. So August, take us through the study that you guys did with like the hardest to get pregnant patients.
Okay, thank you, Alice. Well, as Alice said, we have been working with Gabby for a lot of years right now. We have been working together for 15 years in the field of fertility, and we have been focused on the microbiome field for the last 5 years. We have done a clinical study here in Argentina and also in Spain, where we have recruited almost 300 patients. Patients who have failed at least 2 IVF procedures, like very complex cases. They have been diagnosed with several diseases like endometriosis, PCOS, hypothyroidism. A lot of patients have been diagnosed with autoimmune disease also. And we have been working with them. We have been done our test, our functional microbiome test, and we have been working together with them with the restoration process, which takes around 75 days before a next IVF attempt. And we have obtained a 75% of pregnancy rate with very hard cases. And we have today 129 babies of this study. So we are very happy with this
So
result.
amazing.
And that's why we are here, trying to help more women and to help more families to be.
It's just incredible because this is a cohort of people who had not been able to get pregnant even with very expensive, invasive medical intervention for years and years and years. And in just 75 days, you were able to restore their gut to a fertile biome.
Yes. In fact, they have been looking for pregnancy in average for 10 years. And in average, they have
Oh my
failed
gosh.
4 IVF attempts. And half of our patients have failed also treatments with donated oocytes, and not their own
Wow.
oocytes. So they are very hard cases. But together with the fertility specialists, we have worked a lot and we have achieved a very good pregnancy rate. And we have a lot of families today. So it's a
It's
very
amazing.
good work.
So when I did the testing part of your program, I
Yeah.
took a vaginal swab, I took a blood spot, and then I took saliva. So and it was so easy. So for everybody to know, it's a super easy thing to do at home, and you get a very sophisticated report. You hop on the phone with August or Gabby, and they walk you through what the report means. But let's walk through each one. So when we talk about functional microbiome, what are we really meaning? Like, what is it about the microbiome that like I can't just do vaginal swab alone?
No. Well, the microbiome is just the family of microorganisms that are in your body, that you have born with them, and they have been changing during all your life, and everything have affect your microbiome, like stress, drugs, food selection, everything affect your microbiome. But the microbiome is something that it's very hard to study because there are a lot of them that can't be cultured in a common lab. So the technology to detect them is very difficult to have in a lab. So what we have done in the study is to study the microbiome as it should be, with NGS or with sequencing all the microbiome. But we have found some specific microRNA molecules that are very, very small molecules that the immune system secreted according to the changes in the microbiome. That's why we call it functional microbiome study, because according to the changes in your microbiome, in your gut microbiome, the immune system, which is in the mucosa of your gut, will secrete these microRNAs that we can capture them in different tissues, not only in the rectal tissue because it's specific of your gut, but also in your reproductive tissue. That's why we collect them in your vaginal swab. These microRNAs also affect a lot of metabolic functions in your body, and that's why we combine this study in your vaginal swab with different biomarkers in the saliva and in the blood, because we want to know which is the exact effect of your microbiome disbalance doing your body, so we can work as a whole in all your body.
It's so much more precise than anything else on the market.
Yes, it's not only a microbiome study. That's what we want to know. We want to let you know. It's not only study the microbiome, but also how is the microbiome changing, affecting your body or your metabolism.
Right.
So we work on your microbiome.
And your fertility potential.
For sure. And this is the final end.
Right. Because it's kind of extraordinary to think about it. Like, our fertility potential is such a reflection of our vitality. So what I've learned from you all is that we have so many symptoms of not kind of being our vital selves, like whether it's constipation since we've been a child, or skin things, right? Or fatigue even. I think we try to chalk up fatigue to stress all the time. And I was so stunned when I got my results, because I had an overgrowth of a friendly bacteria that is in like every product that I was consuming that I thought I was doing right. I was drinking loads of kombucha, even though it would make me a little gassy. I loved kombucha. And so I was having my watermelon kombucha all the time. And I had too much lactobacillus. I was eating lots of fermented foods because I was fermenting the foods myself. I was drinking all this lemon water. Like, for 15 years, I've been doing all these things, August, that I thought were healthy. And they all created this imbalance in my body.
Yeah, Alice, as you know, there is like a tendency worldwide about microbiome and about the benefits of using probiotics, but there is no test to customize the use of them. So what we realize is that, the microbiome that we study, it's not an infection at all. It's what you're saying. They are all normal bacteria that are in your gut or on your reproductive tissue that are disbalanced. That's all. So if you have an overdose, this lactobacillus, because of your life happen, you are not able to have these kind of probiotics. You will be benefit by the using of other one, right? Or maybe if you...
And I was on this broad spectrum. I think we all do that, right? Like, we all think, well, we're supposed to take probiotics, right? Yes, we all think that because they're everywhere. Prebiotics, probiotics, symbiotics. I mean, there are so many everywhere. And I had been on a broad spectrum, 11 strain probiotic since I had my son. And I admit that there were some benefits right away when I was taking it. But then I learned from you all that, like an antibiotic, a probiotic is not designed to take all year round for the rest of your life.
Exactly, Alice. And it's very important to combine the use of probiotics with the food selection also, because it's important to have a food selection to benefit the growth of the bacteria that we are restocking in your gut. So it's the combination between the use of probiotics, also some prebiotics, and the food selection, which will give you a success in your new microbiome or in the restoration of your microbiome. So this is
Got it.
one thing, to have what you have exactly, to have personalization of probiotics, and to have a good combination with the food selection. This is a clue.
It's really amazing though, because I think we've all bought into the like friendly bacteria. And you know, there's the old adage, too much of a good thing can be bad, right?
Yes, it's like always, it's too much or too less, but it's always the good one.
Exactly.
You need it to be in balance.
Right. It needs to be imbalanced. And I appreciate so much too, that a lot of the dietary changes that I needed to make once I got to the restoration part, and there was 3 parts to the program that you guys put me through. One was the diet, and that started right away.
Yes.
So for like the first 2 weeks before I even got the rest of my kit, I already was making these dietary changes that made me feel great, had me going to the bathroom a lot more regularly.
That's good.
Which was, and let me tell you, I feel like it's a miracle doing progesterone injections right now, August, and I do not have the constipation side effect.
Oh, this is great news.
It's only because of the Microgenesis program. That's the only explanation.
Probably we are working on your gut, so it's good. It's a good sign that you're not constipated.
Very good. Yeah. It's a very, very good sign. And that's like one of the hardest things I remembered about doing my transfer with Dante, is that the progesterone makes you so stopped up because it slows everything down. But learning from you all, like how many vegetables I should be eating per day, you know, cooking them, not eating just raw vegetables, you know, making sure I'm getting different sources of fiber. It just was so incredibly helpful. And now they're sort of lifelong things. But you also had me taking the custom probiotic for 75 days, and then also a handful of nutraceuticals. Yeah. How did you go about figuring out which nutraceuticals regimen each of these different types of women needed? Because it's so personalized. It seems like very difficult.
Yes, the restoration program, Alice, is, as you said, it's a combination, and every part is very important. It's diet and exercise. Don't forget the exercise.
Right. I've been getting my sweats in.
You have done the exercise, and also the customized probiotics according to the microbiome signature, and also the nutraceutics. The nutraceutics are mainly vitamins, amino acids, some minerals, and they are all according to the biomarkers that we are testing, because most of our patients have been suffering for hypovitaminosis, anemias. Sometimes they have like leaky gut symptoms that we need to repair the intestinal barrier. So every biomarker that we are testing is for something, right? We are going to give you some option to take and to restore all the things that we are measuring. And this will take 75 days.
Which is nothing compared to how long we've all been suffering. I mean, truly, if I look back on the last 15 years of my life, having gone through chemo, I'm sure it destroyed my gut. There was even a time I was hospitalized for 3 days with severe intestinal pain. They could never find the source of it. Yeah. And I had gone on this like extreme raw vegan diet for a month, thinking that I was cleansing my gut, and it ended up being in the hospital for 3 days. So I think I just tore myself up. Yeah. And so this is such a nourishing program to go through. I felt one of the things I was so surprised by is that I had a skin condition on the back of my arms called keratosis since I was 12. Like the moment I hit puberty, I had those bumps on my arms, and going through the program, I don't have it anymore. I'm 45 now.
Yeah,
I don't have that anymore. It's gone.
Yes, it's expected to happen, Alice, because all the microbiomes are connected. So once you are working on fixing the gut microbiome, which is the most important in your body and which is a reflection of the rest of them, you are fixing not only your reproductive microbiome, but also your skin, your respiratory, all of them are connected. So once we work in one, we are fixing the other ones. Yeah.
It's amazing. So let's talk about how we share the microRNAs so that even if you do all the right things and you're eating great and everything, when you're kissing your partner, or even kissing your child or kissing your pets, you're exchanging these microRNAs that are circulating in our blood, right?
Yes, yes, you are in your family, with your partner, with your kids. You share the microbiome profile in general. You are having same kind of food, same kind of habits, and you are having contact between each other. So it's not only the microbiome which is connected, and once you study the microbiome, you see a lot of connections in the family, but also the microRNAs. You're exchanging all the time. So we are working right now on a study on the male, because we know that right now we are working only in the woman of the couple, because this is our first approach to the study, or to this study. But we are working on having a male study or a couple study, so we can work on both in the couple, because once we are fixing one, we need to fix the other. So you are not things.
Bad ones back to you, right? Exactly. Yes. So that you don't need, second and third rounds of probiotics or the nutraceutical part. Yeah. And it helps to have your partner on board, right? So we heard from a lot of women in your program that, their husbands started eating like them and they started feeling better too. So you could just see it anecdotally that they both started feeling better. I remember one couple said to me that they started to take walks in the evening instead of being couch potatoes. They were doing all these projects at night that they normally were too tired to do. And it was just because they were both eating differently.
Yeah, yes. In fact, when we are interviewing couples during all these years, sometimes we observe that it's only the man who has like gastrointestinal symptoms, not the woman or the couple.
Isn't interesting? But they still share the same microbiome.
Yeah. He has the symptoms, but they are sharing everything. Sometimes it's not only about the symptoms or the quantity or the quality of the symptoms, but it's important to try to, in the couple, to try to share the food selection, because it's everything. Everything counts.
Yeah, everything. That makes a ton of sense. If there's any questions out there for those of you who are jumping on about your own fertility biome, what the symptoms are of an infertile biome, we're going to get to that in a second. If you have any questions about my frozen embryo transfer, one of the things that I want to ask you, August, and this is, if you didn't see this, I live streamed my FET last week, you guys. So that is Nico's embryo, we hope. Nico's embryo, my dog.
Oh yes, I can see it. It's a blastocyst.
Yes, almost fully hatched. And then here we go. That little dot right here. Yeah, that is Nico's implanted embryo. That little spot of light. Isn't it cool?
Yes, it's cool picture.
Science is amazing. It's amazing.
Yeah.
And I am so unbelievably bloated. And as August and I decided, like, this is the time that you want to be bloated. I was bloated before the Microgenesis program, and then I had a 6-pack. So I walked into that FET, August, with like a 6-pack. I would make Dante hit my stomach of all my muscles because I was so muscular, in part because of, the Microgenesis program. And then 4 days after my transfer, my stomach just went, and it just my belly is so swollen. It's just the belly. Only my belly is swollen, where, I used to retain a lot of water in my first pregnancy. I retained a lot of water, and I'm not doing that with this pregnancy so far. Well, we hope I'm pregnant. I don't have the confirmation yet. I'm still in the 2-week wait. But with Dante, I felt like I was bloated from like head to toe right away.
Yeah.
And this is just all bloating in the belly.
It's important to continue with the diet, the exercise, and drinking a lot of water during this period.
Yeah.
You should stop the supplements and the probiotics, but you need to continue with diet on the pregnancy planning, and also on pregnancy during the first trimester at least.
That is the hardest part. Let me just acknowledge that, because it was super easy for me to stick to the diet before I started to have kind of already weird, not so much cravings, but more like, ooh, I don't want that today. A little bit more of aversions. And that's the thing that I find so hard. Now I'm sticking to the morning breakfast of like, I eat 7 vegetables for breakfast with sourdough toast and with my 2 farm fresh eggs from my own chickens. But I do find that I'm craving carbs more. And I didn't really ever crave carbs. And I'm finding that there are some things that, and I don't know if it's with the injections or maybe because I'm going to get a positive beta August, like why I'm having these, these like food things already. Like I was craving the craziest thing the other day. I wanted a piece of sourdough toast with cream cheese and tomato slices. I don't think that I've eaten that combination of foods in like years and years. And all of a sudden I had to have it.
Probably it's the hormones.
It must be the hormones.
We are working with a dietist there in the US, which is she's Annalise. And we are working with our patients there, and she's having some free consults with them to guide them through the diet, because we know this is the worst part of the program.
Yes, that's the hardest part.
Because we are sending you everything in a little package, and you are going to take one of these capsules. But the diet, it's half of our work, but it's your work also. And we are here to try to guide you, but Annalise, she's the one who really knows the details on the food selection and how to help you with some different recipes and diet combination, because sometimes you try to select and you always eat the same, and this is not good at all.
Yes, right. We need variety.
Your food selection, because you get bored and you stop doing this.
Right, exactly. I also became very sensitive to the flavor of salt.
Oh yeah.
Like normal amounts of salt, I'm suddenly like, oh God, that tastes so salty. And that kind of came out of the blue too, because I love a little sea salt, over my eggs. So I can't even salt my eggs in the morning with sea salt right now. I can't handle it. Okay. Isn't that crazy?
Yeah. This is expectable. According the stage of your life, this is something expectable.
Right. Assuming that I get the positive pregnancy test, probably. Yeah. Right.
And you have a lot of hormones in your body right now. So it's something that can change your food habits and stuff.
Exactly. Yeah, exactly. So Casey, first Kayak Katie, I hope that I responded okay with that, is that, probiotics isn't the answer. These generalized one size fits all solutions is just not the answer. And this is why we wanted to work with Microgenesis, because they came up with such an incredibly personalized approach for our community. And that's sort of the frustrating thing. It's like, it's not the anti-inflammatory diet. It has to be the anti-inflammatory diet specific for you, based on what they learn about your microbiome. And the microbiome is 70% of your overall immunity, right?
Yeah, for sure. It's everything should be personalized, because today everybody knows that you need to eat healthy, you need to take probiotics, everything could benefit yourself, but you really don't know how to select them. So our approach is to try to personalize the anti-inflammatory diet, the use of probiotics, the nutraceutics, because it's very common that we have on our first meeting with the patients. What are you taking? Okay, I am taking these vitamins, CoQ10, folic, this prenatal, this, all of
this, all these herbs.
It's like 11 bottles in the picture. Okay, why? This one friend told me, this is what about my acupuncture, this is my physician, this is my, and they have like 10 bottles. So this is a lot, and it's not personalized. So that's what we want to have, some educational sessions with the people, because it's not everything to everyone.
Yeah, right. Well, so Casey is dealing with recurrent yeast infections.
Okay.
And, if you go to, and we were hoping Dr. Sherry would be on today, because if you go to even Dr. Sherry, who, loves Microgenesis and is super behind the program, she would treat with an antifungal, right? You would just keep treating the yeast infection over and over and over again. And then the sort of older wisdom was eat yogurt, take your probiotics, right? And all these things, but even that's generalized. So what do recurrent yeast infections, what red flag does that raise for you about her microbiome, August?
Yeah, there is a difference between an infection and a dysbiosis or a colonization, because yeast could be part of your normal microbiome, but in a very, very small amount. So if you're suffering a yeast infection because you are having like an inflammatory vaginal fluid and it's very symptomatic, in this moment, you probably need an antifungal. But most of our patients have a yeast colonization. When you have a culture, they have a little bit itchy and they have yeast in their vaginal fluid, and that's it. So this is for probiotics, because we need to put the good bacteria in order to the yeast to go down. So it's a balance. It's to rebalance the microbiome, because if you use an antifungal, this will get worse, the dysbiosis that it's already occurring.
I see. Okay, that's important to note. So if you're taking an oral antifungal to cure the yeast infection, but you have an imbalance in your gut, it's actually going to make the imbalance worse, even though it cures temporarily the infection, and then you'll just get another infection.
Yeah.
So you need custom probiotics that helps rebalance the specific flora for you. And you can't take a broad spectrum probiotic because it could do the same thing, make the imbalance worse.
Exactly. You can't take broad antifungal, broad antibiotics, or broad probiotics. Everything should be in the exact moment that it needs to be. If you have an infection, bacterial, you need antibiotics. If you have a fungal infection, you need antifungal. But if it is a dysbiosis, you need a probiotic.
You know, that's so true even in a hospital setting, right? I mean, at least we've gotten to the place with antibiotics where, case in point, a dear friend's wife who's pregnant, 16 or 17 weeks pregnant, got a terrible kidney infection. She actually had sepsis, and they put her, since Saturday night, they had her on a broad spectrum antibiotic that was doing nothing until they cultured the exact infection, found what it was. They got the right antibiotic to kill the bacteria, and now she's turning the corner. Exactly the same.
Exactly.
So, you know, at least we're getting there, I think, in these more acute management, you know, areas, you know, in those kind of emergent situations. Of course, we need that personalization for our wellness.
Yeah, for sure.
You know, and it should be standard of care, but we have a long ways to go, I feel like, in this country.
Yeah, but
we're making it standard of care.
Yes, we're on the way.
We're on the way. Exactly. All right. Do you guys have any other questions for August? I have some other ones that I'm going to fire away, but I want to check in with you all. Please ask your questions about Fertile Biome, what you can do to prepare for pregnancy or for doing a round of IUI or IVF. There's lots and lots of good reasons to pursue medical treatment for fertility. We're just advocating that people do basically a fertility check-in with Microgenesis so that you can know exactly what's going on in your microbiome. Make sure it's a fertile one. They will look at a vaginal swab, a blood spot, plus a saliva sample. You'll get a highly customized report and then a program to restore your fertility potential. And just as a reminder, when they did this, with some of the most difficult to get pregnant patients out there, they had a 75% success rate, which is amazing. And we also have kind of a cohort of people that we have been putting through. And out of 13 patients who have completed the program, we already have 6 pregnancies, don't we?
Yeah, we have.
And mine should be the 7th.
Yes, hope so.
Yes.
In the US, we have started a little program for some patients. We have been working with 30 patients for the last month. And right now, 13 of them have completed the 75 days of restoration, and 6 out of them has a beta positive test, which means a pregnancy test positive. They are pregnant. So we are very happy with this because they are not exactly the same profile that we have been working in Argentina or in Spain. Mm-hmm. They are all patients that before IVF, they haven't tried IVF. Right. Some of them have tried IUI,
which is important. Yeah,
for 2 or 3 years. Mm-hmm. It's a different cohort of patients because we know we can have a solution before IVF.
Yeah, exactly, which is super exciting. I think I'm the only one that already knew I had to do an embryo transfer because
Yeah.
the only way I could conceive is using my frozen embryos from 14 and a half years ago, which is so crazy that I transferred, an embryo that was that old and
Yes,
had
it's
been
crazy.
refrozen 8 years ago. It's crazy.
Yeah.
Crystal is asking a really important question. So we are catching people sometimes when they have a transfer right around the corner, August. And so in this case, Crystal has an upcoming transfer in late September. So she's probably well on her way of like scheduling all her appointments. So in this case, Crystal, there's not going to be recommendations that like anybody could do in advance of the embryo transfer, but it does seem to me that of course the ideal scenario, August, is having the whole program in the 75 days before trying. But it does also seem like if someone has their heart set and they don't want to delay getting going, that doing the diagnostic is still really important because the dietary changes alone and maybe the probiotic is all they might need. And is it still okay to proceed? I mean, if she's going to do it anyway, isn't it better to just sort of support the microbiome alongside the pregnancy attempt? Or is that absolutely contraindicated?
It's not contraindicated, but it's not our indication. We try to assure a success in our patients, and we are working with customized probiotics, nutraceutics, and diet. It's completely free of drugs, so it's not a one day to another process.
Right.
We are not using drugs.
Right.
So we need at least 60 days to restore the microbiome. So you can start we have some patients that got pregnant during the program, right? But
That's not true. Yeah, right.
It's not what
you did have that happen.
Our patients, right? We recommend them to try to stick to the program for 60 days. And once they accomplish the 60 days, so we know everything is restored according to our previous results, they can go get the embryo transfer and seek for pregnancy.
Yeah. And Crystal, just so you know, I did delay my embryo transfer so I could do the program, and I would delay it again in a heartbeat. So I know that might sound really devastating to you, but I'm 45 and I've been waiting 3 years to do this. So I figured what's, 3 more months. And then I did get upset because then my insurance plan delayed it again. And then my lining didn't cooperate. So Microgenesis made some adjustments. And then when I went into this August cycle, literally everything went flawlessly. Every appointment checked out perfectly. I felt so much better. There was no stress. The day of the transfer, my lining was perfect. My embryo was perfect. All of it just lined up. So I just would advocate that if it's something that you really, want to consider doing, go to microgenesis.net and just read around. You can do a free consult with any of the fertility specialists that they have on staff. And if you're lucky, even maybe August or Gabby can do one, and it is a free consult. And no harm in talking to someone. I just feel like I'm even tolerating my fertility meds this time around to August, even though I'm so much older than I was when I had Dante. I feel like that having my gut health restored, I'm tolerating all the side effects of the medications way better.
Okay, yes, that's what I am going to stress, because we are having some little talk with patients, trying to see which is her fertility history, her reproductive history, her clinical symptoms. So we could know if this could be a benefit for them, because there are some symptoms that are more frequent in our patients. So if you are interested, you can book a consult with us and we can try to talk and see if we can help you. It's everything according to the person. So yeah.
Which is so important. Yeah. So wherever you are in, your path to parenthood, this is something that our team, we've been thinking about for years, our Fertility Answers team. So we have a medical advisory staff, we have scientific advisory staff, and we handpick every single solution that we work with. And the microbiome has been on our radar for years, but the research wasn't there yet until we met you guys. So I feel really grateful for knowing that I'm heading into this pregnancy. I'm healthier, I'm stronger, even though I'm almost 8 years older. not almost, knowing that I'm 8 years older than the last time I had a pregnancy. So I'm just looking forward to the whole pregnancy going better too, because I'm better. So of course the pregnancy is going to go better.
Yes, and as you know, Alice, there are multiple studies that assure that if the microbiome of the mother is okay, the microbiome of the baby will be better. So our next approach is to try to study our kids, our babies in our family, in our microgenesis family. But we know that if we can restore the health of the future mom, we can help have healthier babies. So that's
amazing. Yes. And I can't wait for that because, you know, my son, when he was born with a rash on his face, which I know came from my microbiome issues. Of course it did. He, you know, I was his home. So it had to have been the home environment. And he also deals with like very dry skin and light eczema. And so I just look forward to understanding more about his own microbiome and then learning the creative ways that your dietitian comes up with to help kids restore their microbiome so that they enjoy all the foods that they're eating and they don't feel like we're taking all their fun things away.
Yes. We are trying to help on the food recipes and to try to do things like easier for the woman and also for the family. Yeah, for sure.
Yes. Awesome. Thank you. Thank you, Lauren. How do you feel? You are so far into your pregnancy at this point. So check in with us. Did you do a follow-up on the gestational diabetes, Lauren? I want to hear everything. So give us a quick little update before we have to run. So any other questions that people have about your own fertility biome, your microbiome, what it means to have a fertile biome? I think, you know, some of the things that are so surprising, August, in addition to things like recurrent yeast infections, are a lot of the skin stuff, but mood, you know, how connected the microbiome is, the gut to the mood. Oh my God, you gave birth 7 weeks early. Are you and the baby okay, Lauren? Oh my goodness. Her water broke at 33 weeks. Oh my goodness. Well, gosh, congratulations. How tiny is your little peanut? Oh, oh my gosh. I want to hear more. I want to see pictures. Oh, he's already home. He spent 3 weeks in the NICU. Caleb, beautiful name. We have a friend named Caleb. He's home and doing great. This is amazing. Well done, Mama. Well done. Oh, that's incredible. My goodness. I went so late with Dante. Like he never wanted to come out. I was 41 weeks. He was not coming.
No, he was very comfortable.
He was super comfy in there.
Sure.
He's still very attached to me too. So we have a very attached household over here. So I think, you know, what is that, you know, gut brain connection? Why do we have so much more anxiety and depression with, you know, a leaky gut or with gut dysbiosis / imbalance? Why does that happen?
There is a direct connection between the gut and the brain. In fact, they call the gut the second brain on the body. So everything that it's affecting your gut or your microbiome is affecting your mood. So we working on the microbiome on some metabolism actions like, for example, the tryptophan, which works on the macrophages, on these specific cells. We can work also on the mood, on the sleep, on our patient don't suffer from sleepiness, or they are not suffering from this kind of changes. They are feeling so much better in this sense because the connection between the gut and the brain is directly. And they start to sleep better.
I sleep so much better. Holy cow. And then I started tracking my sleep with my Apple Watch, and I can see how much restorative sleep I'm getting. So I kind of geeked out on it. I wanted to see all the data, August. I can't even get over the difference. It's amazing. And I mean, it just feels so good because I wake up rested. You know, I'm able to handle stress so much better than ever before.
Yeah, this is something that we really be thanks for the patients, because they are always saying to us that even the results of the pregnancy test, that of course they are hoping to be positive, so am I particularly, but they are feeling so much better during the program. They are feeling less tired, more energy bodies, with energy to do more things. And this is something that it's very comfortable for us.
Yeah. Better focus, better concentration. All these women who have been dealing with either constipation or diarrhea, they're going to the bathroom normally, skin things. So like I call it my microgenesis skin because and a friend came to visit. She's like, your skin looks amazing. And I'm like, it's microgenesis.
Yes.
Really, I can't take any credit. It really is.
And one thing that some of the patients refer to us is that they are losing weight with our diet.
Sure.
And they have been trying a lot of diets all their life. And this is the first time that they are losing weight and they are not feeling tired at the same time. But
exactly.
This is
or cranky.
Personalized, and they are doing exercise because exercise is the best complementation to the diet.
Yes, right. That's so important. I have been taking it easy during the 2-week wait. I do a lot of walking on my farm. And a lot. And so I haven't been on the bike, but I promised myself I'll get back on my Peloton once I get that positive beta test, because I want to keep up my exercise throughout the entire pregnancy so badly. Yes. But I do love that this pregnancy I get to be outside. I mean, it's so green. I don't know if you guys can see that in the background, but we are just surrounded by nature, surrounded by trees. We have all these deer in our yard. We've got chickens and ducks and wild turkeys and so many different types of birds. It is lovely. And so we spend a lot of time outside, just like breathing in the good air and everything. So I promise that I'm going to get back on the Peloton next week after I get my positive beta.
I take your promise.
I'm a woman of my word, especially for you two, for you and August, for you and Gabby, of course, always going to be my word. So if you guys don't have any other questions, we can wrap it up, but I want you to know a few things. Like Gabby and August have extended free consults for our Fertility Answers community through at least the end of September. We're hoping we can do more. If you book a consult, we just request that you keep it. You can always reschedule, but no shows are really painful for the relationship. So please don't do that. But just go to microgenesis.net. This is something I'm telling you, like our scientific advisory board, medical advisory board, we really look long and hard to find the right microbiome partner. This is the right partner for our community. Dr. Sherry's behind them. Serena Chen loves it. We'll come back next week. We've got, coming off of the summer break, we're going to have a much more regular schedule. Make sure to follow at Microgenesis Fertility though. We have a whole bunch of really cool content that's going to be coming out on their channel. So make sure that you guys follow them. And August, thank you so much for carving out time to have a chat with us. I can't wait to have you back. It's wonderful to see a smart, beautiful woman doing great things in the world. And thank you for just being of service and for dedicating your life to helping to bring healthy babies into the world.
Thank you. Thank you, Alice. It's a pleasure for us to work on this field and to help more families to be. So thank you. It's
amazing.
Here.
All right, everybody. We'll see you next time. Thank you so much. I promise as soon as I know if my embryo transfer worked, you guys will be the first to know after my mom, of course. Bye now.
Thank you. Bye.